Time now for our Life and Info segment, where we focus on information we hope is useful for your everyday life. And today we're going to start with e-cigarettes, e-cigs, with vaping-related illnesses emerging in the United States and some reported deaths as well. The South Korean Health Ministry is now advising the public here in South Korea to refrain from using these electronic cigarettes. However, it was quick to point out that no cases of such illnesses have actually been reported in this country thus far. Park Se-young with more.
More than 500 cases of severe lung illnesses linked to vaping have been reported in the United States so far. The Centers for Disease Control is conducting a large-scale investigation and does not yet know what in electronic cigarettes is causing the illnesses. A key focus of the investigation has been vitamin E acetate, which is used to thicken THC oil. In response, the South Korean Health Ministry will carry out its own investigation into whether the e-cigarettes being distributed in the country contain THC oil or vitamin E acetate, as well as a study of the two substances' toxic properties. The Korean Health Ministry says no cases of vaping-related illnesses have been reported in the country, but advises the public not to use them until the studies are completed. To help monitor the association of e-cigarette use with illness, e-cigarette smokers are asked to see a doctor if they experience common symptoms of lung illnesses. In the U.S., the CDC closely analyzed 373 of the 530 reported cases and found that two-thirds of people with severe lung illnesses are between 18 and 34 years of age. Men made up 72% of them. Using previously collected data on e-cigarette users and health insurance, the Korean Health Ministry will look into suspected domestic cases. The Ministry of Economy and Finance said Monday that the government will review adjustments to taxes on e-cigarettes, which are about 40% of those levied on traditional cigarettes. The changes will be made after a joint study with the Ministry of Interior and Safety and the Ministry of Health and Welfare due by the end of this year. The ministry will also study overseas cases and come up with necessary countermeasures. Park Se-young, Arirang News.